in one course. So with us is also several students from the other university, which is following the special programs. They can attend to the other universities and taking several programs in the other universities outside their universities. So, okay, now I will uh, maybe give a time for Dr. Santi as our Vice Dean to welcome you here in Universitas Airlangga, because last week maybe uh, there is no
Yeah, an opportunity.
opportunity and welcoming
Yeah.
speech, I think, from our dean or vice dean. So please, Dr. Santi, the time and place is yours.
Okay. Thank you very much, Pak Ato. Assalamualaikum warahmatullahi wabarakatuh. Good day. First of all, I would like to say thank you very much on behalf of Dean to Dr. Fazeela for providing your time. Although today is holiday for you, you still have time for us. So I think it's very special for us students that now we are very glad to have you today to share how Maldives can control the pandemic. So I think we can learn much from Maldives from this lecture. We hope also that this collaboration between Faculty of Health Science, National Maldives University, and Faculty of Public Health, University of Airlangga, can develop to other activities such as joint research, joint publication, and also student mobility. Maybe you can send your student to our campus, and we can also send our student to your campus. And also, it's a great pleasure to you if you can invite also our staff to give a lecture for your student. Uh, I think we can continue our discussion to talk about our to develop our activities more. Maybe we can provide certain meeting for you and your staff, Dr. Fasila. And then I would like to say thank you also for Department of Epidemiology to have this webinar, and special thanks to Dr. Ato Ila as a coordinator for epidemiology of communicable disease, because the subject is included in epidemiology of communicable disease. And we have a special talk about COVID-19. Uh, Last week we have a professor from Paris University, Professor Robati. He is also a team of task force in COVID-19 in France. So we share, Professor Robati also share about his experience to control the pandemic in France. And today we have you to share about the Maldives country experience in controlling this pandemic. And next week we have also professor from Taiwan, Professor Lee. He will share also about Taiwan's strategy to control the pandemic. So from Sharia lecture, we hope that the student and also the teacher can get a lesson learned from this lecture, so we can give some input to help the government in controlling this pandemic, or to end this pandemic soon, because now we are still struggling to flattening the curve or to decrease the number of the COVID-19 cases. Okay, finally, I think all of the students wait for your lecture. So once again, I would like to say thank you very much for Dr. Fazeela for your time today. We are very glad to have you and have interesting webinar for the students and all of the participants. Hope we can have a productive discussion at the end of the lecture given by Dr. Fazeela. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Santi. Thank you very much for that. So I think I can start the lecture now, right?
Okay.
Yeah.
Yeah, Pak Ato. How about the lecture? We can start. Dr. Ato. Hello, Dr. Ato. I think maybe he has a problem with the connection. So I think you can start. Before that, I would like to introduce you. We have Dr. Ati as head of Department of Epidemiology. She has the responsible for running this program here. Dr. Ati, please. Yeah, please unmute.
Yes. Hello, Dr. Fazeela.
Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh. Nice to meet you.
Nice to meet you too.
Okay, thank you, Dr. Ati. And now, how about Pak Ato? Did you hear us?
Yeah, I temporarily use my phone to guide this, but I will try to reach the meeting through this laptop after this. But I think we can continue to next session, Bu Santi.
Yeah, okay. Thank you, Pak Ato.
Okay, dear students, I think now we will move to the next session, which is the presentations of COVID-19 measurement and measures in Maldives 19 brought by Dr. Fazeela. Dr. Fazeela is the Dean of the Faculty of Health Science, Health, yeah, if I'm not wrong,
yeah.
Health, Life Science in Maldives National University, MNU. So last week or last 2 weeks, if I'm not wrong, she already brought this course to our international class from Malaysia, Philippines, Timor Leste, and some from Africa.
Yeah, Gambia.
Yeah. So today, maybe she will present that material to us. Okay. So Dr. Fazeela, time and place are yours.
Thank you, Dr. Ta. I'll start the lecture. Assalamualaikum and a very good afternoon for those who are in Indonesia.
Yeah, thank you.
Waalaikumsalam.
Waalaikumsalam. Good afternoon.
Okay, when I continue the lecture, if I'm too fast or if I'm not clear what I'm saying, sometimes when I do the lecture, I become a bit, my speaking becomes a bit fast. So if it is not clear, just unmute your mic and say it. I'll be happy to slow down. Okay?
Okay.
Okay. Basically, what I'll try to do today is I'll try to see what are the containment measures that we took in the Maldives, and what were the outcomes because of that. Were we able to flatten our curve, and was it effective in the Maldives? What were the implications that we had to face because of that, socially and also financially? And before I start the containment measures, I will try to give a brief introduction, a very brief introduction to Maldives, because unlike many other countries, Maldives has a very unique geographical structure, and the way we had to deal with the COVID-19, it is very expensive for us, and also the measures that we had to take, it had a major impact on areas that we didn't think of. So I will go with the introduction to Maldives and then containment measures. And then we'll see if the outcomes are effective in the Maldives, and then finally concluding whether it's effective or not. And after that, I will give a very final remark regarding the social impact on because of that. Any of you have been in Maldives before? I know Dr. Atalva was here, right?
Yeah, I was there 2 years ago. Such
Wow.
a very, very beautiful country.
Anyone else who has been here in Maldives?
Not yet.
Not yet.
Not yet.
Not yet.
Okay.
Hopefully next year.
Inshallah.
Inshallah.
Yeah. Okay. If you look at the Google map, if you do a close up of the Google map, you can see Indonesia, Malaysia, Singapore, your neighboring countries. But with that close up, you will not be able to see Maldives, because Maldives is such a small country here. Google has just marked it, and you can see blue patches. That's the economic zone of Maldives. You still can't see Maldives there. So I will show you a bigger picture of what Maldives looks like. This is what our country looks like. We have about like 150 square kilometers at the total area, but economic zone is 859. That is around here where we do our fishing. And all these atolls together, we have got 19 different atolls divided into different parts for the administrative purposes. And within that 19 atolls, we have about 1,192 islands. And this is one atoll, how it will look like. This is actually where the capital is. And this is how that atoll looks like. And each of these atolls will have small, very small islands. And you can see each of these dots is actually an island, and people actually do live there. So we have got about 1,192 of those small islands. And total of the population, the whole population of the Maldives, the residential one is 557,426. And out of that, our local population is 344,000. And our average life expectancy is 73.9. I have taken life expectancy here just to show, because life expectancy, how long we are living, the old population, it's an important aspect of all the measures that we took under COVID-19. And when we divide those islands, the 1,190 islands, we have got about 187 islands people living there, and capital Male, where another part of like half of the population lives here. Do you know how big our capital is, any of you? Any idea? You can see the population is almost divided between all the islands and capital Male. So I just want to highlight this point, because we'll be talking about the population in capital Male as we go through. Any idea how big it is? I think Ata also knows, right?
Yeah, I'm trying to shut up, but yeah, if you let me to answer, I will.
Any student?
Yeah,
Well,
any student?
okay, Dr. Ata, you can go ahead.
Okay, you know, in Malaysians, it's only 1 kilometer per square. You know.
Yes. The whole capital of Maldives is only 1 square kilometer, and you can see 227,000 people living in this small island. Okay. And when I saw this as an island, all these, almost each of these blocks here is like 10-story buildings now. So it's like apartments, people living in one apartment building. It'll be a lot of people, like about 40 different families, probably most of the times living in one apartment building. So it actually had a good, we had to consider the situation of capital Male when we consider the containment measures. And also another area we had to look at is that we had 155 resorts and 77 industrial islands. These islands actually had very few, especially the industrial islands had very few local people. And there are, as you can see from the 555,000 people, out of that about 1/3 is foreigners. And foreigners living in this island, we had to take extra measures when we did all the containment measures, especially in resorts and in industrial islands. About 81,000 people are living in these two areas. Okay, the containment measures. I don't know when Indonesia started their containment measures. When did you all start it? Is it just with Wuhan outbreak or after that? Okay, what I will try to do is I will go one by one, month by month, what we took as containment measures, and then I will come to a point where we will see what were the impact of those containment measures. The very first containment measure we took was on 21st of January. We started the containment measures as early as in January, just after the outbreak in Wuhan city. Because China is one of the countries where a lot of tourists do come to Maldives, and Maldives, our economy actually depends on tourism. More than 50% of our GDP comes from tourism. So we had to start our containment measures as early as on 21st of January. For the very first measure was travel advice issued from people returning from China. And then the same month, on 23rd, we started initiation of airport screening using thermal cameras, and also port health people in there and testing whether they have any symptoms. And on 24th, we initiated awareness programs on coronavirus COVID-19 to the public, and also to all the laborers and workers who are there in the Maldives. Mainly where TV, where radio, TV, and also social media, the Viber groups, all those things. We started our awareness programs. And on 25th, we started screening the seaport. Seaport is a very busy area in Maldives, because Maldives, because our islands are small, we don't grow much, and we don't actually have much of if we say living, what we use as groceries and those things, almost more than 80% are important to Maldives from our neighboring countries. So seaports has to be, the screening has to be initiated there, those who are coming from other countries and the things that they are bringing from their other countries. And on 30th of January, a travel restriction on China imposed and help desk established at the main airport. This was something that our government didn't want to do. Actually, that's what I understand from all the news and everything. They were not very willing to do it, but because of the public pressure and everything, they had to put a restriction on China, travel restriction on China. And on 31st, the first statement of the first suspected case of COVID-19 was announced in the Maldives. And the fear was really very high at that time, but alhamdulillah, that was not a positive case. That was just one suspected case. And we started strengthening our program from there onwards again. And then February, because we had a suspected case, we feared that we might be having more cases and it might be there already in the Maldives. So on the 1st of February, the contact tracing was started and emergency committees were established, and the health ministry and other agencies that are involved, Health Protection Agency of Maldives, everyone got together, and multi-agency coordination committee was established on the same day. And a technical advisory committee from all the among the doctors and also from public health people were established as well. And on the same day, Maldives Red Crescent began community outreach work on COVID-19. This was really important for us because more than 80,000 laborers are working in the Maldives, and most of them are from Bangladesh, and their living conditions are not as good as we think. And if there is any spread, if there is anything, if the community spread starts within them, we fear that it might go out of hand. And on 3rd, isolation of suspected travelers and 7 contacts were done from the contact tracing group team. And travel restriction to China was strengthened. And on 8th, again, isolation facility was established in one of the resort. Because there were not many tourists coming, we were able to get the resort facilities converted to isolation facilities. And then on January 18th, evacuation was done for the students and then workers who are in Wuhan city with the help of Indian military. So they came to Maldives and they were quarantined in this quarantine facility. On 25th, quarantine of 2 Maldivians took place. I think those two were working in a resort and there were symptoms, so they were quarantined and observed whether the symptoms developed further. And on 27th, temporary suspension or entry from selected cities of South Korea was established because of the major cluster, the church cluster in South Korea, because South Korea is also one of the countries where we get a lot of tourists, especially at the time of February, March, during that time, because it's their winter time, I assume. So a lot of tourists come from there, and we had to put temporary suspension on them as well. And March was the most busy month that our containment measures for those who are working on containment measures. During March, a lot of activities took place, a lot of measures were taken, and all the actions were strengthened. And just this slide wasn't enough for me to show everything, so I will go a bit further after this one as well. On 3rd of March, travel restriction on South Korea was established, a total travel restriction. And again, on the same day, establishment of the National Emergency Operations Center, NEOC, and Technical Advisory Committee was officially established. And this was the very sad day for Maldives, the 7th of March. 7th of March was the day when the first case of COVID-19 was reported in the Maldives, and it was a case by a tourist who returned from Maldives to Italy. And that person, when he went to Italy, he got positive, he got tested positive and he reported it back according to WHO procedure. So based on that information, we had to quarantine, we had to do contact tracing of who got contacted with that tourist, like who served which and where he went, all that we had to do. And this was the very first case of COVID-19 in the Maldives. And on 7th, another island, another resort, we had to quarantine. Again, it was a Italian tourist who was isolated in this quarantine facility, got positive, and temporary ban on Italy was imposed because of this. And we have to, if we look at this timeline, this time was the time when the outbreak was starting in Italy, and a lot of people were getting positive in Italy. So we had to actually do we have to restrict Italians from coming to Maldives. And sad to say, China, Italy, and all the European countries, and also Korea, they were like one of the biggest customers of Maldivian tourism. So it was a big decision, but government took it anyway. And on 9th, Sandy Butler Resort was again was closed, and because 2 confirmed cases were reported from here, and again these were not Maldivians, these are again tourists, or in other ways, in other words, we can say they are imported cases from other countries. And on 12th, 699 tourists who were actually in Maldives were not able to leave because of all these restrictions. The government allowed them to leave after testing and everything. So the whole Maldives was kind of cleared. Not the whole Maldives, but most of the resorts were like they were allowed to send back their tourists back home with the precaution measures. But even then, with that measures on, we had a really bad case where one person got positive on his way to Italy because there were no direct routes. The people were traveling from Maldives to Russia and then to Italy, and there was a case, and there was a lot of political issues going on because of that. But anyway, we were able to send all 699 people safely to their home. And on 15th, entry ban was again announced for some other areas in the North Rhine, and also in these countries where they did have community spread, and we were afraid that they might bring it to Maldives. And on 20th, 2-week suspension of boat traffic from resort islands to islands inhabited in local were actually announced, because we felt that most of the cases at this time during March time was from imported cases from tourists. So we didn't want anyone to take COVID-19 to any of the inhabited islands from the resort. So this suspension was an important decision, and this was actually very strictly imposed, though few people actually went against it. And again, on the same day, hotels in Malé were not allowed to take any new guests after this day, 20th. All the hotels were banned from taking any more guests, as there might be community spread from imported cases, leading to community spread. And then on 20th, Maldivian authorities stopped issuing visas for all the countries around the world. So this was the day when the border was closed for the border of the Maldives was closed for all other countries. And there was a total ban. Our international airport was closed, and also there were few flights operating from the main airport to other islands just to carry local people. No foreigners were allowed starting from these days, because all visas were stopped. But some local people who were studying or who were working in other countries were allowed, but just only for the local people. And during March, as I said, March was the most busiest and difficult month for us. And during March, other activities took place, like scaling up of emergency response team that we had, and the government identified another 300 bed capacity for quarantine and 200 beds for isolation centers. Bear in mind, all these beds are actually resort islands, the rooms in resort islands, because there were no tourists. We were lucky to have that facility that we could convert into our quarantine facilities and isolation facilities. And also establish screening, triage, and referral at all levels for COVID-19, and where patient can go, and whether if someone gets very sick, where should the person be triaged. All those things were identified in March as well. And designated hospitals to receive, like where the person should be taken if ICU care is required, because we didn't want all the patients to, if in the worst case scenario, we didn't want COVID-19 patients to go to all the hospitals. So we identified certain hospitals where they could be treated. Infection prevention control measures were placed in all the workplaces, all health centers, and any government offices if it needs to be open. And to limit service provider encounter, optimize service delivery platform, outreach mechanisms like teleconsultation, e-prescription, and delivery of medicine from pharmacies to the patients who require it. Those things were established as well. And I think this is a very good measure. Because of that, many people actually stopped going to hospitals, stopped going to pharmacy. And a recent study that was out last week, it shows that about 64% of the people surveyed said they didn't have to go to the hospital. So that was a good thing. And postponing all non-essential elective procedures in hospitals and all the surgeries, this was also done to give time of the people, doctors and other people in the health facilities for the COVID-19. This was actually done. And again in March, support was offered to migrant population because there was total ban, and also because there was stop of businesses and everything. We had a lot of people, a lot of migrant workers who are on low-level jobs coming out of the road and also asking for assistance financially and also food-wise. So support to migrant population was offered, and this was strengthened via Maldives Red Crescent and community support. And many flights operated to repatriate migrants. For example, more than 2,000 migrants were actually, about 2,000 migrants were actually transferred back to their country during this time. And integrated COVID-19 ARI, ALS surveillance system was established with the help of WHO. It's called GoData. GoData was used for contact tracing and how and also to enter all the data and see how the clusters were working. And tracing contact of potential positive cases through mobile application Tracking. This was also established, and people were asked to put this in their phones and make sure that their Bluetooths are on so that the tracing can be made easier. And during March, again, we started a mechanism to provide timely update to public through dedicated websites dedicated for COVID-19. And also there were Viber groups, Viber bots that were actually activated by the National Disaster Center so that people could have timely information and people could actually ask questions and those things. And also encouragement of online shopping and home delivery. People were asked not to go to the shops. People were asked to do online delivery via social platforms, online shopping platforms, and delivery services were a little bit difficult at the start, but I guess people got used to it. We still do online shopping. A lot of us still do online shopping. We don't go to the shops still. And in April, this was the month we actually restricted. We actually had to make really hard decisions because we knew at this stage there might be community spread going on in our country, and it might be just a matter of time, and infection might be just in a like situation where it's in hibernation, it will come out very soon. So with that fear, there was curfew between 5 to 8 p.m. It was established in Malé. Malé is the island where about half of our population lives. And a health emergency declared on 12 March was extended by the government till end of April. And this was the very sad day for Maldives, 15th of April. First confirmed local transmission case was identified on this day. So we had to actually strengthen the contact tracing and also the testing, random testing, and also those who go to flu clinics, we had to test them all as well. On 15th, because of this, travel restrictions were again imposed between the Malé, where we live, and also between all the surrounding islands. No boats were allowed to go, and also no cars and no buses were allowed between the cities of between the cities like the Greater Malé, where people live in other end of the bridge. And on 16th, a complete 48-hour curfew was imposed for Greater Malé region. This here complete means complete. We were not allowed to go out of the house. Even for food, we were not allowed to go. If we had any issue, if we don't have food, we are supposed to call the National Emergency Center. Nobody was allowed out of the house to make sure that we do good contact tracing to ensure that we reach everyone who were contacts of this first case. On 17th, the 2-day curfew for Greater Malé was extended by 14 days. And the public health emergency that was in effect since March was extended again on 30th April. And the curfew in Greater Malé was again extended on 30th April until 15 May without further notice. And on 30th May, the health emergency in the Maldives was again extended until 30th May. And during May, the curfews in Malé was extended. The people were getting used to it, staying home and washing hands, and also wearing masks if in the case of emergency, getting out of the house to go to hospital or something. And also on 14th May, the state of emergency was again extended. And 28th, the curfew and entry restrictions in the Greater Malé area was extended. Because we have to do this for Greater Malé area, it was a really difficult decision because the apartments, the houses are really small in Malé, but to prevent from community spread, prevent the community spread, we had to put all these all these curfews and also restrictions for the people, just to make sure that it doesn't exponentially grow in the community. On 28th, elders who are 60 years and above are allowed to go out for morning walk only between 5 to 8 a.m. And a helper was allowed to go with them if they needed. But this is only for people who are 60 years and older, because there were a lot of social issues, psychological issues coming out, saying that people are getting stressed, people are getting disturbed psychologically. So this restriction this leniency was given for older people. And again on 28th, 3 persons per household were allowed to go out for shopping and those things, for necessary things, but just for 2 hours. And again on the same day, offices, construction work, banks, etc., other offices were allowed to operate with restrictions, with HPA guidelines. Things like wearing masks was mandatory, and also having the facility to wash the hand when going into the offices, and having the sanitizers on the place, and also not going as groups, but the maximum number of people who could actually go together was maximum was 3 people. And then social distancing was a necessary measure during that time. Even in the offices, if they couldn't manage it in the workplaces, they were not allowed to do any work, and they had to arrange those if they needed to operate. And in June, shipping traffic between the islands in the Maldives was restricted, because during this time, from the March to June, the community spread actually started spreading, and there was a lot of cases going on in the Maldives, especially in Malé. I will go through those after the containment measures. On 2nd June, the quarantine measures were over the Greater Malé area was extended because still the cases were increasing at this time. And on 10th, 32,391 samples were tested by that time, and 1,962 tested positive on this day, by this date actually. So we knew that it is community spread was actually escalating. It is actually going to a stage where we might actually go to a surge. So we were afraid that we need to actually impose more measures to contain it. And on 15th is the curfew again, but no, they actually allowed people to go out with no special permits from police. But the restrictions like 3 people maximum, mandatory mask, and also social distancing were imposed as were mandatory when they eased the curfew in June. In July, travel restrictions between islands that do not have any cases of infection were lifted out, but during July, actually, it was it started spreading to other islands. So the travel between those islands were actually imposed, and people were restricted from traveling to those islands or coming out of those islands. And the health emergency imposed in the country was again extended during July. And on 15th, the entry stop was lifted for countries such as Germany. Okay, this is an important point for us because from March to July, 3 months time, our tourism was totally on hold, and a lot of people lost their job, and a lot of people, families lost their income, and the disease wasn't the only thing going on in the Maldives. At that time, people were getting frustrated. People were like psychologically affected a lot. So because of all that, and also because of the damage on the country's economy, that we had to actually give some leniency with precaution. So it was given to Germany, was one of the first country. And the health emergency, even though we gave that leniency, the health emergency was extended. The curfew in the Greater Malé region was eased from 11 to 5 a.m. And the 14-day quarantine was lifted for tourists from countries from which it is permitted to travel to Maldives again. Here, you might be asking, okay, so those who are coming, there is no quarantine for them. We had to allow them, but keep in mind here in Maldives, each one of those tourists will go to an individual island. They will not come to the local islands. Tourists are not allowed to go to the local islands, unlike in other countries. So that was one measure that we took. We thought it might work, and it did actually. For other travelers, this can still be requested before entering the country. Travelers must register, and further data will be recorded upon arrival. And on 15, schools reopened for all grades in islands without COVID-19 transmission, except preschool cases after 3 months, ceases after 3 months. It is still closed in islands with positive cases. The schools that are in islands where we have any kind of community spread, it is still closed. So all the schools in capital Malé, it is closed. My daughter hasn't been to school since March. It's like September, and she's enjoying a big holiday this year. In August, on 7th of August, the night curfew in Greater Malé was imposed again from 10 to 5 a.m. And on 10th, the state of emergency in the Maldives was again extended till 6th of September. So this month, September, on 2nd, travelers will have to present negative COVID-19 test, which is not more than 3 days on entry. First, we allowed from Germany, but it didn't work very well. It actually had it was a little bit effective, but not totally. So the later, what they did was they changed the rule. Now they have to actually get a negative COVID test, and it should not be more than 3 days old on entry to the Maldives as a tourist. And on second, travelers will again be allowed to stay on several islands or several accommodation facilities. However, this must be notified at least 2 days before they start their trip. And on 7th, the public health emergency was again extended to 6th of next month, October. So we are still actually on emergency, though I'm here in the office. A lot of people who are in Maldives still work from home, or only very few people actually are allowed to come to the office and work. And on 7th, nighttime curfew is in force in Greater Malay from 10 to 5 a.m. So we don't come out of homes after 10 p.m. till 5 a.m. On 7th, again, travel to other islands except for to and from airport is subject to 14 days quarantine. So we are not allowed to go to any other islands in the Maldives because we are living in capital city where there is community spread. We cannot go to any of the islands in the Maldives unless I'm willing to take a 14-day quarantine. So because of this, I haven't met my parents for since March, and my parents haven't seen me and my kids for like more than 5 months now. On 10th, tourist entry to Maldives is allowed provided the negative COVID test not older than 72 hours can be presented. And on 23rd, mandated by law to provide 14 days of paid leave for self-quarantine and dependent quarantine. This was on 23rd. The president enacted that bill saying that everyone who needs to be quarantined or isolated due to COVID-19, they have to be given a paid leave if they are in a job. And also anyone who has a dependent who needs to be quarantined or isolated, in that case, for example, a minor got positive and need to be quarantined, then the mother or father or the aunt or someone will accompany that child. So in that case, they will also be given a paid leave for 14 days. Okay, those are the main measures that we took, and important containment measures from the start to still the measures that are continuing. Contact tracing is still continuing, and it is actually showing that our cases are decreasing. Testing targeted groups and, this should be random. Random testing is also going on, and isolation and quarantine is still continuing. Awareness programs are still continuing, and psychosocial support is still continuing. And here you can see beautiful pictures of these are all my students and staff actually volunteering. So I'm very proud of them. Resource mobilization. How we did it, how we took all those containment measures, it actually had another side. It has a big financial impact on the Maldivian economy and also to the government. The government actually has to give a contingency budget of about 14 million for the activities that are taking place as containment measures. And also we had to mobilize non-governmental private sector health workforce, licensed retirees, medical and health trainees, and also volunteers who has been volunteering since from the March, and use of some inoperative resources as possible alternative isolation facilities and quarantine facilities. This was also something that was very helpful for us. And optimal accommodation arrangements, optional accommodation arrangements for frontline health workers who are working in containment measures such as random sample taking or contact tracing, those who don't want to go back to their family because of fear that they might be carrying COVID-19. For them, government actually provided accommodation. They rented hotels that are not in operation. So in a way, the government was facilitating as much as possible, and government incentives was also introduced for frontline workers and volunteers. And are we successful? It has been 201 days since the first case in April, and are we successful in our measures? What were the impact of those measures? Let's see. COVID-19, this is the present situation in Maldives after 201 days of first initial case. Now we have 9,939 cases, positive cases were reported in the Maldives. Actually, this was on 24th. If I took it yesterday's one, I think it will be 10,000 now. But on 24th, it was 9,000, and on that day, 54 new cases. And active cases was around 1,300, and recovery rate was 86%. So this is something really good that we have to consider in Maldives. Now the recovery rate is 86.5%. And when I presented on 17th, it was 33 cases of deaths, and now it is 34. One more case, about 90-year-old has passed away. And in relevan region, we have to say, compared to the number of cases that we have in Maldives, the number of deaths in the Maldives is not that high. But if we compare this amount to the total population, you could say that Maldives is one of the worst countries because of our population is very small, and also 34 is actually a big number if you compare to 330. If we compare the residential population of 500,000. So daily incidence per thousand, if we look at it, we have a new case per the rate is 7.97. And new cases the day was on 24th was 46. And you can see it has hikes. It has the number of cases at the start in May. There was a really on one day we had a lot of people, and these fluctuations, these peaks, because sometimes what happened in the Maldives at the start was when one got positive from a labor quarter, like in Singapore, everyone else in that labor quarter actually tested positive as well. So during that time, the government was actually trying to relocate the laborers in congested areas, but this was at the start, and one day it was a lot of cases, and it actually had a big impact on how the government should proceed with relocating the laborers and how we could help them out to minimize the number of cases within their community. And you can see another day there was a lot. This was a day when one of the household of about 40 people, 34 got positive, and then it slowed down and then started increasing, and some days are good, some days are better, as you can see. But now we have started seeing a slow but downturn in the Maldives. And if we look at the number of cases reported and total cases, active and all that in the same graph, you can see we have got on the 24th, it is 34 deaths, and 8,596 has recovered, and total is 9,929. And active cases that we have in the facilities of in the resorts and in other isolation facilities, now it is 1,299, and new cases on 24th was 46. But yesterday it was a bit more than 46 among the locals, plus the Bangladeshi community that we have here. And if we look at the case classification, here 13% is active, 86% has recovered, 0.34 death, and our hospitalization rate was 6.69. So if we look at the total number of cases of 9,000 and the hospitalization rate, it is actually not there in the Maldives, 6.69. And out of these, most of them actually do recover. And the nationality, if we look at the nationality of the people, is I highlighted the workers who live in labor quarter areas. It is quite high among the Bangladeshi people, and most of the positive cases are among Maldivians as population is bigger. And have to note that the 62.86% out of this, more than 90% is actually within Malay area, not in other islands. And Indians are the third highest. And we have Italians, Philippines, Nepal, and others. All these are mostly tourists and also those who are the resort workers in those resorts. And if we look at the gender, it is 2,991 female and 6,000 male, 6,000, almost 7,000 males. You must be wondering why such a big difference among male and female in the Maldives? Why is COVID targeting the male population? Well, the thing here is the population here, Bangladeshi, Indian, Sri Lankan, Nepalis. Nepalis might have, we have a few female, but all these three groups, it is mostly male workers who are working here. So because of this difference is there. And also a lot of Maldivians who are working in the resorts, they are also male. So there is a high number of male compared to female in Maldives. And this somehow they have not reported in the database. A number of clusters, 9,990 are 9,919 cases belong to clusters, and 18% of the cases were imported cases in the Maldives, and 2%, only 0.02%, 2 cases are local transmission that we saw. So Alhamdulillah, cluster, it belongs to the clusters, and the community spread is somehow a little bit controlled, more than better than that we thought. And a number of clusters, it is about 15 clusters in the Maldives, and it has not actually, the number of clusters has not increased dramatically, but the clusters itself has grown a bit bigger compared to the lecture that I have given on 17th. And you can see these 2 cases are the 2 community cases that we couldn't find where did they get it. And this is actually imported cases from tourists. And all these clusters, we can actually identify them easily. This is the national security one. This is the national police. And this is one of the business cluster, and one of the grocery chain cluster, and then this is also grocery. So it is actually, we know where the clusters are, and also contact tracing has done a good job in the Maldives, identifying the clusters and the contacts and trying to contain them. Were we effective in our measures? What do you think? Any of you read anything about Maldives? No? Okay. No information at all yet? That's why I'm here, isn't it? Okay, let's see if our containment measures, I just talked about a lot of containment measures that we took in the Maldives, and are those containment measures worth it? Are those effective? Let's see. This is one of the very earliest model developed by my colleague, Dr. Rahima, who is a public health PhD, and Dr. Afzal, who is an epidemiologist. They developed this model at the start of the COVID-19 in March, and they were writing this paper, and it's been published in Asia Pacific Journal of Public Health. According to their model, this will be like, with obviously with a lot of assumptions there, but compared to their model actually seems to be very correct in Maldives, and compared to their model, the number of cases you can see, actual cases, it has a hype, it is not a surge, but it is a hype, I would say, and then it decreased in increase, and it has again shown decreased here. So compared to the projected incident cases weekly, the number of new cases that we had in the Maldives is much less. So we could say that the containment measures implemented in the Maldives were actually successful in reducing the peak of the outbreak and also reducing the number of cases and flattening our curve. And also all the containment measures gave time for us to get prepared for the worst scenario, get the workforce mobilized, get the facilities prepared, get the CPR machines for testing, and also to get the ventilators get ready, because Maldives don't have very few. So Maldives have to order everything from other countries. So to get it and set the place ready for the worst case scenario, actually it gave time, the containment measures, and we were able to cater every single case that happened in the Maldives, including all the foreigners were provided best care here. And I have to say that even those who are from the labor quarters, those who got positive, everyone was actually taken to isolation centers. Everyone was taken to quarantine, those who needed to be quarantined. And we actually, there were differences, but with little discrimination between locals and foreigners workers here. So I have to say it is actually effective, and we were able to flatten the curve and also decrease the number of cases in the Maldives. And because COVID was a major pandemic that we never thought we had to face, Maldives was not prepared for this at all, like many other countries. There were other aspects that we have to consider when providing these containment measures, when taking these containment measures. For example, socio-economic impact on the Maldives, the government job portal showed that 35% of employees had reduced salary and 49% were on no pay because of COVID, layoff and all that. 50% of the individuals or family businesses got affected. Some says that their business went bankrupt, and some were not even getting a single cent out of their business. So this was one of the major impact. So the government had to take a lot of measures to cater for those psychosocial, to cater for those who got affected economically as well, and also social impacts that actually impacted the population. So the government actually, recurrent spending on other areas has to be decreased. Salaries of political appointees and senior heads are also decreased, and developed an economic stimulus package. They have to provide this to support those who got affected, and also the income support allowance for 3 months was also done for those who got affected, those who lost their jobs or on no pay. And financial aid for Maldivian students. Again, this is also another population we had to take care of because of the COVID-19. A lot of students were strained in Malaysia. A lot of students were actually strained in other countries like Australia and UK as well. Challenges during this time, we had a very small infrastructure of health facility. The infrastructure was small, the capacity was limited, so we had to expand it. We had to buy CPRs, and we had to get ventilators, and we had to prepare the people for that. And the geographical dispersion of the islands, as I showed at the start, the islands were separated. It was kind of a challenge when we look at from the sides when we had to bring the samples, because we couldn't develop a lab in every island. The health center in the island actually collects a sample, and it needed to be transferred to an island where the facilities are available. So that was a major restriction, major challenge because of all the travel restrictions. between the islands, and separation was not a good thing in that situation, but I will go into this a little while later. Delay and restrictions in access in tertiary care, because tertiary care is mainly available only in the capital city and in one other island at the southernmost area and one other island in the northernmost area. So accessing those three tertiary care facilities for those who required it was a major challenge for us. Workforce burnout and limited staff for health response was a major thing for Maldives because we had very small workforce. Almost all the students were recruited, almost all the staff in our faculty, medical school, nursing, they were asked to volunteer, and all the people who are retired were asked to volunteer as well. So this was a major issue as well, a challenge for us. And high dependence on imported medicine, equipment plus food, that was a disadvantage, a challenge for us. We wanted to close our borders, but we couldn't close our borders totally, the seaports, because we need to bring those equipments and medicines as well. Extensive use of government emergency funds affected the other programs, like all other programs going on in the health ministry. They had to take a fund for this COVID-19. And some extent of public disobedience was also observed during this. As I went through from January to September, you could see a lot of ban, a lot of restriction, a lot of movement restrictions. A lot of Maldivians did actually abide by this, but not all. Use of vehicles when it is not allowed, being outside during curfew hours, and not wearing masks. These were some of the issues that were raised by police. For example, about 1,580 people were fined because they were outside the house during curfew hours, and about 1,180 people were fined because they were not wearing the mask when it is mandatory. And about 274 people were fined because they were using vehicles like motorcycles and cars during the vehicle banned hours. Advantages are geographical dispersion. Though it is difficult to transport things and travel from island to island, actually, I have to say, Maldives being a small island nation and having our island separated by sea was actually a mercy on us, because this dispersion actually let us implement laws and regulations like, okay, no travel between islands, meaning that if there is even one case in one island, the next community can be protected because we could impose the travel restrictions. So this was one of the advantages if we look at it that way. And also another advantage when we implemented all the containment measures were health awareness was made really easy in Maldives, because there was a high use of internet users in Maldives. For example, we like mobile subscribers, the number is about 900,000. We have a population with the foreigners, it is only 550,000. And internet subscribers is like 312,000. So it is almost same as our population. So when we try to aware the public using social media and activating Viber bots and those things, it made the whole thing much easier for us. And even now, when they send the messages to our phones regarding, okay, this is the restriction, now don't do this, and this is where you can gather, this is how many people you could go at most. All those things were updated every day, and number of new cases, everything were updated every night. They get messages to our phone. So that was a good thing. And another good thing and another advantage in the Maldives was that there was universal health coverage in the Maldives, and everyone is eligible, and there is no restriction or there is no upper limit for health insurance for the local population. And that's basically it. Any questions so far?
Okay, Sidan, I think this is very interesting presentation from Dr. Fazeela. Yes. When you say that the geographical dispersion is one of the advantage of Maldives, I absolutely agree because if we want to move from one island to another, so we should use like a water bus, if I'm not wrong.
Yeah.
Yeah, so I think it's yeah, it's a little bit difficult to transport from one island to another.
Yeah, when the government restricts, that means the ferry system will be banned. So it'll be, people cannot go actually. Those who even have their own private launches or ATPs, they will not be allowed to go because the police was around each island, so they cannot go. Actually, if they go to an island, they will be reported and the police will go and straight to that island.
Yeah.
So,
Yeah.
Okay, student, is there any question?
I thought maybe the screen, their screen. Dr. Fazeela, can you
Yeah, Dr.
stop
Fazeela, can you
the
stop the share screen?
oh, okay.
Okay. Is there any question from students? Please.
yeah, student? Pak Atok? Hello, Pak Atok. Dr. Atok? Can you hear us? Dr. Atok, I think Pak Atok has a problem with the connection again. Yeah. Hello, student. Hello, student. Did you have any question? Please, you can ask directly to Dr. Fazeela. Please raise your hand, or maybe you can write your question in the chat forum. Hello.
Hello, Miss. I have a question.
Oh, Elizabeth.
Okay, yes.
Okay, please.
Should I open my camera or is it okay to stay up?
If it's possible, you can open your video.
Okay. Okay.
Okay, please.
Okay. Before that, thank you very much, Ma'am Santi, for the opportunity. And hello, Ms. Fazeela. It's a pleasure to meet you. I have a question. If I'm not mistaken, on March, you said that Maldives provide an application to trace contacts of potential cases through a mobile application. Like, how does the application work? Is it like an online form or something? And then my second question is, do the residents of Maldives comply with all the government policies related to COVID-19? Because in Indonesia, or maybe in other country, there are still many people who underestimate COVID-19, and if there are people who do not comply, are there any sanctions for that? That's it. Thank you very much.
Okay, the first question, how does the mobile app work? Is that what you asked? Okay, the mobile app was actually developed by the President's Office, the IT people there. What they did was, we have this, because Maldivians use, almost all Maldivians, a lot of people, even my mom, she is like 65 plus. She use smartphones. So what they did was they had this mobile application developed where people have to turn on the Bluetooth. So Bluetooth will actually, with that application, it will actually detect all other people who are around that person. So if any one of those people get positive, they will actually check the data in their application, in their trachea. The application is called trachea. They will collect that information, phone number, and and then they will actually call up those people saying that, okay, this person got positive, you were around that person in this hour, you were at, like, in this distance, so you need to give us information. So that's basically just a cluster tracking app that they have actually developed. So when we go out, we turn those on, the mobile application. It is in our phones. The second question, I didn't actually get it very clearly. Will you be able to repeat it, please?
Oh, all right. So my second question is, do the residents of Maldives comply with all the government policies related to COVID-19? Because in Indonesia or maybe in other country, there are still many of people that disobedient uh, apa ya, with with all these policies. Like, and if there are people who do not comply, are there any sanctions for that?
Yeah. Okay, I think at the end with the challenges, I did actually raise the issue that Maldivians, a lot of people, most people actually did abide and still do abide by the restrictions. But there are people who go out of the houses during curfew hours. There are people who actually don't wear the mask when they go out. And the good thing with the Maldives is because our islands are small, even one police in one small island is enough to actually check those things. And also because communities are very small, each island has a health center. They were also able to check. And a lot of police is going around in Male, in the capital area. So yes, disobedience is there. People who goes out after hours, during curfew hours, those fines were there, as I said, about 1,580 cases of fine for after hours being out. Not wearing mask, like 1,188 cases were fined, and use of vehicle during banned hours is like 247 people were fined by the police, and they have to pay the fine. So yes, disobedience is there, but not as much as that we could not control it. We were able to control it. Yes. Did I answer that?
Yes. Thank you very much.
Okay, is there any questions, students? Okay, from your presentation, I think that the most impacted oh, you know, section is in Maldives. It's like in the economy, right? In the economy.
Tourism,
Yeah, special tourism, because I don't know how many percent, but I think Maldives is relied on tourism. So I think the economy is impacted harder than health aspect. Is it true, or I don't know?
The thing is, yes, economy was the one that we can see that it got impacted, but my understanding in this is that if we didn't take those measures, economy will not be impacted much. Tourists will come probably when they don't have restriction. But if that is the case, our population will be like impacted a lot if we didn't take the measures. So there are two sides to it, I guess. If we didn't take it, it's our population, their health. Because we took it, it is our economy. So now we have to come to a compromise at this situation, and that's why border is being open, but with restrictions.
Okay, so from your point of view, maybe if I now want to travel to Maldives, is it safe now for me, for us, or for the traveler? Yeah, okay. Without considering that maybe we should have like some procedures when we go back to our country.
Yeah. If you want to come to Maldives, now the procedure is you have to show a COVID test that is not 73 hours old. So if you bring that, yes, we will welcome you, and then you can go to a single island in the resort. It is not safe to come to the capital city, the hotels here. You can go to the resort islands, and yes, it is quite safe, I would say, the resort islands. If anyone get like positive, they still will be quarantined, they still will be monitored, and they cannot leave Maldives unless they recover fully.
Okay, because in Maldives, maybe we can land in the airport without passing through the capital, right? Because we can directly go to the resort or something.
Yeah, the thing in Maldives is the airport is in a separate island.
Yeah.
So you don't have to even look at the capital island. You can go straight to a resort island, actually.
Yeah. Okay, there's a question from Zahra Salsabila. Salsabila, would you mind to ask directly by yourself,
Directly, yeah.
or do you prefer
Should I
for
read it?
me to read?
Yeah, I will read it. Did
No,
the
no, no.
political election was held in this pandemic, or there was alternative one for it? Political election was 1 year before this pandemic, so we are lucky. If we had the political election, no, we will not be able to. But the local council elections were supposed to be held in April this year, but it was postponed by law. They actually had an emergency meeting and then it was postponed. And what's the next question here?
Yeah.
Is it easy for controlling people in Maldives to do the guideline and health protocol? For that question, is it easy to one thing in the Maldives is actually communities are small except in Malay. All the island communities are small. So when one person actually abides by the quarantine laws or by the government regulation, it'll be difficult for the neighbor to break it, isn't it? So that aspect is there. And also the other thing is when the government tries to educate and aware the people, bear this in mind, 99% of the Maldivians are literate, so they can read and write, and most of them use phones. So awareness is actually quite high, and it is not that difficult compared to many other communities, I would say. So that was also an advantage that we had here. And another thing is our education system is in English, so the younger generation, because school is mandatory, people can read and write English as well, including our own language. So they were able to look through the world data as well. So that was also another thing. It actually at the start put a lot of fear in the people reading the wrong material as well, that we had to deal as well. But I would say it was most of the people actually do follow the guideline. And the next question is, and how the government or maybe the health minister do the containment measure regularly? Our health minister, I have to say that he was one committed minister actually in this case. Because I was involved in the contact tracing at the start, I used to go to the National Emergency Center every morning, me and my colleague. We see minister there starting from the start of the day to the end of the day. So he was very committed and he gave, I think, best effort that anyone could give in this situation. I'm not saying that all the politicians were positive about this. There were people who were against it, but he was one committed minister, I would say. Other question is, as we know before that the containment measures are the effective ways for controlling COVID-19 in Maldives. Is there any petrol or something like that to make people in Maldives easy to access the test? Petrol. Is there any?
Petrol is like apa Pak?
Petrol like a mobile test maybe.
Oh, okay. No, but the thing in the Maldives is we had random testing going on in the corners of the different house blocks. So they can either go there or then the other case is we implemented emergency testing centers where people, if they have any symptoms, they could go there. They will not be allowed to go to the hospitals. And also we had online consultations from the tertiary hospitals where they can call and say that I'm having this symptom. So they will be guided to those flu clinics where the test will be done. So it worked, but and also those who cannot move out of the house because of their age or because they are very young. After contact tracing, if there is any contact among those groups, the random testing groups, the RRT teams will actually visit those houses. They will go to the houses directly and collect the samples from them.
Okay, maybe for helping Levi, about the perspective of the capital of Maldives, you can walk all around the Malay, maybe in 15 until 20 minutes, and
Yeah.
you can reach every places.
Yeah.
It's very
Maldives,
small.
Malay is very small. So when we have random testing means like every other corner or like in every ward, 3 or 4 people, 4 groups doing the testing. And with the testing, some people did actually say no, but police is around there when police is involved, people are more willing. I don't know whether it's fear or what is going on, but they're more willing and random testing actually do work. And now the curve is really flat compared to what we thought. So I guess it has worked in Maldives. I don't know whether we will get a second wave or not. I hope not, but at the moment it is quite controlled compared to what we thought it would become.
Any other question from the students? Because maybe we still have 10 minutes to go.
Okay.
I read at
There is a question.
Resort Hill Island itself and can make self rules for tourists. My question is how if that rule is very possible with country level? Okay, here the government did allow some self rules for the resorts just to make sure the tourists are comfortable. For example, testing in the resorts, it is allowed for the owners if they wanted it, but it is under government regulations. They have to follow the HPA regulations. It is allowed in some resorts, and also like if you get positive, where will you get quarantine? Is it the resort room or is it the government facility? That also can be decided by them in some cases. But if they need tertiary care, then obviously government will take over. They will be brought to the tertiary hospital in the capital.
Okay, is there any question? Maybe the student want to ask directly, speak directly to Dr. Fazeela, maybe?
Okay.
Okay, Bagus Saputra, maybe.
Okay. Hello, Miss Fazeela.
Yes.
So my name is Bagus, and from what I know from your presentation, that the government have been reopened the schools in July or August, right?
Yeah.
Okay, so my question is, what makes the government believe that reopening the school at that time was the right decision, and how they do the health protocols in the school?
Okay. For the schools, I think I didn't highlight this. The school opening, the classes, start of classes is only in the islands where there is no community spread at all, where there is 0 cases only. If there is any community spread, even 1 case, the schools will not be open. It is not open in the capital city. Our children, they are at home starting from March, even now. And for the islands where there is no community spread, the schools, when they open, even then they have to wear masks, and also they have to have hand washing facilities available for them, and sanitizers, and their water. All that are the containment measures that are highlighted by the health protection agency. They have to follow it. And even if they start school in islands where there is no community spread, if they see any community spread, from there onwards schools will be halted.
Okay, thank you so much.
Okay, maybe last question, maybe from student. Is there any other question?
Student from Permata Sakti, Pak, maybe.
Yeah, student from Permata. Hello, He's still there.
From Permata,
Okay.
I think we have. Yeah, we have Permata Sakti.
Okay.
Yeah.
Yes. Okay. So now I don't know. Maybe what is your opinion about the containment of COVID-19 in Maldives? Since, yeah, maybe you say that from the point of from health point of view, like let's say that maybe the cases is decreasing right now.
Yeah, increasing.
But do you think that the pandemic is over? It's already over in Maldives.
Mm, I don't think so. From what we see, it has gone down from like 200 per day to like 40 per day. It has gone down. The number of cases has decreased. The incidence rate has decreased a lot. But I will not say that it is over in the Maldives. And uh, because the borders are not fully open, we don't know actually. I would probably I think this is just my opinion. When the borders are open, the cases when it is fully open from other countries as well, when the tourist number starts to increase, I think the cases might increase in resorts as well, but with because now we have learned a lot, we might be able to deal it better, and also the contact tracing might be more effective compared at the start. So, but I don't think it is over. So probably this might never go away, and especially being a tourist dependent country, we might have to be cautious throughout for a long time until a vaccine is there. Probably that's my understanding regarding this situation now.
Okay, at least if the pilgrimage or Umrah visit will be opened by Saudi Arabia government, maybe Maldivian is one of the country citizen that maybe will be allowed to go to the pilgrimage. I don't know.
Yeah, inshallah.
Inshallah.
This year we were not allowed, so maybe. Yeah, I think the Umrah group that take that give the school holiday packages, the Umrah packages. I think they have started advertising, so probably yes, for the December holiday, yes.
Okay, yeah, hopefully. So we do hope in Indonesia too, because yeah, we are maybe 87% of Indonesian people are Muslims.
Mhm.
And we are impacted hard by this pandemic, as, including Umrah and Hajj pilgrimage. And maybe, yeah.
Can I ask?
Oh yeah, maybe the last question to Santi. Yeah.
Yeah. Okay, thank you, Pak Ato.
Yeah.
Thank you very much for the interesting presentation, Dr. Fazeela. You present the case is very systematic, like a timeline you show, yeah, what the government action, yeah, based on time. Yeah, I have two questions for you. The first one is I would like to know about the cases based on age. Yeah, because in Indonesia, the COVID-19 affected all of the age, since from the baby until the oldest. Yeah. How about the cases in Maldives based on age? Yeah. The first one, and the second one, as you mentioned in your presentation, that you provide isolation, dependent isolation. So how to monitor that the person comply with the dependent isolation.
Okay.
Thank you, Dr. Fazeela.
The first question, the age group. Wait, I will just check that. The age group, the population that got affected most is between the working age group in the Maldives. The young age group is less compared to the
older.
Compared to older age group, and that's why I think because of that, there is also one factor. The number of cases who passed away is less compared to the number who got positive. And another thing is the younger population, because there was total curfew, people were not allowed to go out of the houses. The young population especially were not allowed to go out in any case, even for the war, like even the daycare, school, everything was closed. So it was less among them, but there are cases, and the highest group is between younger the older teenager age group, like 18 and between 30 and like up to the 40 years. That group was the highest in Maldives. Maybe that's why our recovery rate is better compared to many other neighboring countries as well. And the other question is dependent. The dependent quarantine or isolation is because if a minor get positive and if the health protection agency says that, okay, we need to isolate that person, so that means the child cannot be taken away without a mother or without a carer, isn't it? So in that case, the government has made that rule. If the child needs to be isolated and if it cannot be done in the house, now it is allowed if you have a house facility like a separate room or separate apartment. If it is there, and then the child can stay with a dependent in that facility in the house. But if it is not there, and if the child needs to be taken away to a government facility in one of the resorts, which is in another separate island, in that case, a carer will be allowed to go, and the carer needs to be given paid leave because of that, because the carer has to go and care for the child, stay with the child.
Okay, so the government provide for the dependent isolation.
Yeah, all the isolation. If we cannot get isolation facility at home, for example, my house, if I don't have a separate guest room or someplace there where I can get isolated separately, in that case, I have to go to a government facility. Government facilities are in those resort islands where they have taken it for COVID. So we have to go there. There is no choice in it, actually.
Okay, yeah. So actually, I have one question more. As you mentioned that almost 100% the cases is cluster group, yeah?
Yeah.
Yeah.
Only 2 that we couldn't find out. 2
yeah, that you can you explain what type of the cluster group?
Do you want me to show the clusters?
Yeah.
Show it, okay.
Did you can you access the data freely?
Yeah.
Oh yeah. oh, lucky you are.
Okay.
Because maybe Maldives is very small, Pusanti. If we look at the population, maybe Surabaya city, the population of Surabaya city is 4 times larger than Maldives in total.
Okay, I will show you the cluster here.
Yeah. Okay.
This is the clusters we had, 15 clusters. Can you see?
Yeah.
Okay, actually, these are like, what is this? The 2 community cases that we couldn't identify the first case, and the tourist, these are tourists. And that was actually explained in the Health Ministry website. They have this information page specially made for COVID-19. So all the data that I have taken, actually it is available for public. And also every night I have this Viber bot that will send me information saying, okay, today this many cases got positive, and this many are tourists, this many are foreigners, this many are Maldivians, and this is the new precaution government has taken. All that they are in the social media, they will send us. And clusters, yes, we can see this in ministry website. And I know this detail, like this is a grocery and a chain, grocery shop chain. I know these things because I actually worked in contact tracing as a volunteer at the start. So I know where this started, and this is they have given name. MNDF means MND, Maldives National Defense Force and Police, and so we know Maldivians know it's available.
So it means red is, as you mentioned, yellow is grocery.
Yeah, this one. Was this one was one of the earliest clusters, and it has not grown bigger, but these ones it has grown over the time.
So it's different color, is different meaning.
Yeah.
Okay. So there are 4 clusters.
The 15 total of 15 clusters, and all these are community spread clusters except this one. This is 18 is imported cases from tourists. And these two, the contact tracing couldn't actually find out where they got it. We couldn't relate these two to any of the clusters.
Okay. Yeah, thank you. Thank you very much, Dr. Fazeela.
Okay, thank you, Dr. Fazeela. Thank you, Dr. Santi. Thank you, all the students. I think this is the edge of our meeting. So thank you very much from Dr. Fazeela for your very kind lecture and very good presentation, very systematic one. And we do hope that our collaboration will keep continue in the future. We can still meet in the better situation, maybe without pandemic, that maybe you can visit Surabaya to APEC next year. Hopefully.
Inshallah, we were supposed to go this year, isn't it, Dr.
Yeah, sure. And we all are able to visit Maldives again for me again.
Inshallah.
Thank you very much for this opportunity, and I did enjoy preparing this and talking about it, and I would love to know what has happened about COVID in Indonesia actually. That would be good somehow.
Yeah, maybe Dr. Santi will, if you visit Dr. Santi, if you invite Dr. Santi, maybe.
Yeah,
maybe we can arrange, for giving the lecture. We have many staff involved in the province level to give assistance to the governor, and also some of our staff give assistance also to the mayor of Surabaya. So I think it's interesting.
Okay, maybe before we finish our meeting, maybe we should do some photo sessions.
Okay.
Please, all the students, open your videos. And considering that we have 8 pages here, 8 pages, maybe I will count 1 up to 3, 8 times. Yeah. Okay, the first page. 1, 2, 3. Okay, page 2. 1, 2, 3. Okay, please open your video. Third page. 1, 2, 3. Okay, fourth page. 1, 2, 3. Oh, we have 10 pages here.
10 pages.
5. 1, 2, 3. 6 page. 1, 2, 3. 7 page. 1, 2, 3. 8 page. 1, 2, 3. Okay, 1, 2, 3, and the last page. 1, 2, 3. Okay, it's finished all. Okay, thank you, Dr. Fazeela, for your
you.
coming virtually here in Indonesia, in Surabaya. Hopefully, we will meet again.
Yeah, inshallah next year we'll be there.
Okay.
Yeah.
Okay, we can.
Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh. Ya.
Thank you very much,
Baik,
Dr.
kita
Fazeela.
tutup ya. Kita tutup mahasiswa. Terima kasih atas kehadirannya. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam.
Terima kasih.
Jangan lupa absennya ya.
Thank you.
Ya.
Dr. Fazeela.